Hi, and welcome to True North Update. I'm your host, Candice Malcolm, and I am joined by co-host Andrew Lawton. Andrew, thanks so much for being here.
Yes, absolutely.
So we are doing something special today. We are recording this broadcast live. We usually pre-record it, but we decided to do it live today to get you all of the facts and all the information as fast as possible. So before we get into today's news, let's just go through the latest statistics on coronavirus. So as of today, Thursday at 2 p.m., there are 3,845 confirmed cases in Canada, which has resulted in, sadly, 37 deaths. So that cumulative number continues to grow, not quite at the same rapid pace that we are seeing in other parts of the world, but it's still alarming nonetheless. So the big news story at the press conferences today, the prime ministers and then the COVID-19 response team, the cabinet there, the thing that everyone is focusing on and in the media is a story out of Global News. So Mercedes Stephenson over at Global had the scoop today that Donald Trump and the U.S. administration is looking to put troops near the Canadian border amid coronavirus fears. So, Andrew, what happened with this story at these press conferences?
Yeah, it was interesting because I was seeing that headline earlier and thought, okay, that whatever seems like a pretty sensible thing when we know that border containment efforts are pretty much the priority for a lot of jurisdictions with blocking COVID-19. But then to see how quickly this escalated to be the huge story that everyone's focusing on today, I found a little bit odd. The details of it are, and it's important to note that the U.S. hasn't made a final decision on this by what we've heard so far, will be using military to patrol a perimeter about 30 kilometers from the border. Now, military cannot operate on U.S. soil. So they're there strictly in a monitoring capacity. If they detect people, they engage the nearest border officials who will then come, detain, deport if need, remove, whatever the process is. The military will be more there to just turn it over to the border guards. But what's interesting here is that despite this being a matter of America trying to secure its border, Canada has been very resistant to this. Chrystia Freeland said that Canada strongly opposes this, that it could damage the relationship. She said it's not necessary. She said that, yes, the U.S. has the right to do it, but this is harming Canada's relationship. It's a point of pride, as we all know, that Canada and the U.S. share the longest unprotected border in the world. This doesn't threaten that. It's simply a measure, while there is this restriction in place that blocks Canadians from going to the U.S. for non-essential purposes, and this agreement that blocks people from illegally going from Canada to the U.S. and vice versa. So this really doesn't seem to be all that controversial an idea, but the Canadian government is viewing it very negatively.
Right. And I just feel like, I don't know if this is an example of like Trump derangement syndrome in the media, or just, the tone of anti-Americanism that runs through the sort of center-left elite in Canada. But I mean, the story is speculative. It's based on, unnamed sources, and it says they're thinking about it. They're in talks about it. So there's nothing, in concrete that this is going to happen, and yet it really did dominate the press conference. And I mean, this is just a small point of contention, but you can just tell how sort of anti-Trump and anti-American the media are in Canada just by the way that they pose the questions. Like, they make this seem like it's somehow an act of war. One journalist said, Donald Trump has announced that he will be opening the economy for Easter. Does that make you worried? Should we close the border even further? And it's like, well, hold on a second. Trump didn't say that they're opening the border at Easter. He said that he hopes that they did, in a sort of aspirational way. So, the very premise of the question is based on sort of a deliberate misreading and bad faith. So that was the big story that dominated today. And again, I think it's more of a non-story, but we'll have to, I guess, wait and see what comes out in the days and weeks. The story that I thought that should have dominated, there's a big story, came from the Globe and Mail. Steve Chase writes a story about how Ottawa is facing criticism for sending 16 tons of personal protective equipment to China back in February. Really interesting. So Canada was sending personal protective equipment, including clothing, face shields, masks, goggles, all the stuff that we're really in short supply of and in need of right now. We sent that to China back in February 4th. Just as a point of reference, Canada had already had its first positive case of coronavirus in January 25th. So this is after we already had the virus in Canada. We began shipping equipment to China. And it's interesting to note that our colleague Anthony Fury, writing in the Toronto Sun, reported on the same story a week ago, but somehow the Globe re-reported today and it became a big story on social media. So Andrew, was this really a story that was focused on at all during those press conferences today? Did we get more answers or more of an explanation as to why Canada is sending gear to China when we're in such short supply here?
No, it was very to it. I mean, there were a couple of questions here and there. The one case that really came out was the health official, the senior public health official, Dr. Theresa Tam, saying that, basically defending it, saying that at this time, China was the epicenter and it's important to deal with basically all hands on deck, throw everything you can at the point where it is really becoming the biggest problem. And at that point, it was China, specifically Wuhan. So very much defending it, saying at that time, the gear was needed in China. It wasn't needed around the world. Now, I guess the problem with that is that if Canada was at that point in time so aware that China was the problem, why were travel restrictions not put in place from China at that point? And I think it reinforces the double standard here, that when it came to foreign aid, Trudeau realized, yes, China's the problem. We've got to put everything we can there. But when it came to the domestic story, Canada wasn't paying any attention to the very same reality that it had acknowledged in the different context.
Well, and I think it's also worth noting that report that came out that said that basically China sat on this information, that they knew, like right up to the highest levels of the government, they knew that this disease was caused by human-to-human transmission. They lied about that, kept it secret. An analysis of the situation found that if they had released the information that they had when they had it, the global spread could have been contained and reduced by 95%. So China really is a bad actor in all of this, and I don't really see them facing the kinds of consequences that they should. The fact that, again, Canada's facing shortages is really difficult to justify after sending this. But there was a report, I believe it was Evan Solomon, said that senior government sources told him that China was going to be sending back this equipment. So I guess now that China has sort of contained the virus outbreak over there, they're going to be returning the favor. I mean, I'll believe that when I see it, but it's really kind of jarring to hear that Canada's kind of giving away all this aid and sending money to all these other places when we really have a problem here at home.
Yeah, and certainly for the numbers that China has seen, it's unclear how they even have that much equipment left over to share. But I mean, of course, I'm optimistic and hopeful, but you're right. I mean, believe it when you see it.
Yeah, and so likewise, I think on a similar strain, we're seeing stories today. There's a story in iPolitics about hospitals anticipating shortages. So despite repeated assurances from the federal and provincial governments, frontline healthcare workers, in Ontario are growing increasingly weary of the dwindling supply of the same personal protective equipment. At least Toronto hospitals have begun rationing the protective gear as the COVID-19 crisis deepens. And I mean, we're also hearing of a lot of frontline workers being infected. I know that in British Columbia, there was a report that said that 55 healthcare workers in British Columbia had been infected. In Toronto, there was similarly over a dozen, I believe I saw, that had been infected. So I think this all results in really like a lack of proper preparation. We know that there's going to be a big increase. We know that there's going to be a lot of people coming in with symptoms, and we need to have our healthcare workers prepared and having the right equipment that they need. Was this something that any of the ministers specifically discussed or explained during the press conferences today, Andrew?
Yeah, Ontario Health Minister Christine Elliott had actually denied that there is any rationing taking place when it comes to equipment. I mean, she's just reiterating what I think a lot of the hospitals have said, which is that there are very specific criteria about who needs which personal protective equipment or PPEs, and those people are getting them. Now, there's also another aspect in Ontario, which is rationing care itself. We've heard reports of cancer surgeries being bumped back, so not just non-elective things things, but very essential, in many cases, life and death surgeries that are being bumped back as hospitals deal with it. Now, this isn't to say that these decisions aren't few and far between at this point, but we've seen in Italy what happens when the system does get overwhelmed. In Ontario, where a lot of these stories are coming out, as of an hour ago, the government still says that the system is not overburdened at this point. I mean, that's certainly not the story that we're seeing in some cases like the ones you mentioned, but overall, the government is still saying it's on track. But at this point, we are still looking at, in Ontario in particular, numbers rising pretty rapidly. So over, I think, 3 or 4 days ago, we were averaging maybe 40, 50 new cases a day in Ontario. That went up to, I think, 100 new cases were added yesterday, and 170 new cases were added today. Now, you have to take this with a bit of a grain of salt, because Ontario is trying to boost its testing capacity. So you never know if more people are getting sick or if they're just testing more people and reporting it more accurately. But we are still seeing an increase that looks to be getting to exponential in Ontario, which is something that, I mean, as you're in my province, is certainly of interest to me, but we're seeing in other provinces as well, numbers continue to rise as well.
It's good at least that the government is giving that assurance, because you have to trust that, you know, they are monitoring it and trying to keep ahead of it. I mean, the thing that we're trying to avoid is a situation like we saw in Italy, like we're now seeing in Spain, and in to some extent in New York City, where it's just such a massive surge that it's not really about, you know, the rate of transmission or the death rate, but just a vast sheer number of how many people in one specific area get infected. We know this thing is just incredibly contagious. I'll give you an example. There was a funeral in Newfoundland. So according to health officials in Newfoundland, there are now 67 confirmed cases of the coronavirus. And so health officials said that of those 67 cases, 44 of them can be traced to one individual who was overseas, and he came home to St. John's to attend a funeral. So at that funeral and then beyond, he is connected to 44 of the cases. So that just kind of shows how quickly this thing can spread and how one individual can really multiply and lead to cases. There's a bunch of other examples of similar things. There was a dental conference up in Vancouver. You got to wonder why these things weren't canceled, because, you know, by the time this thing was held, same with, there was a curling tournament in Edmonton, March 11th to 14th. I mean, that was just last week. I can't believe this thing was allowed to be held at that curling tournament. 11 people who happen to all be medical professionals have all been tested positive for coronavirus. So, Andrew, you know, it just shows how quickly things can change and how prepared we need to be in order to get ahead of this curve.
Yeah, and I think all of these numbers are really reinforcing why governments are starting to switch to more of that enforcement mentality, because despite the fact that a lot of people are being responsible and doing what they're supposed to, we're also seeing more and more stories of this where people are going around what the advice is, and now it's no longer advice, but rather an order.
Right. So why don't we go through some of the initiatives and announcements that provinces have made? I know that a bunch of provinces have now announced fines for people who don't self-isolate and self-quarantine. So
yeah, I'm just pulling up the list here. The one that happened in Ontario, individuals can be $1,000, corporations can be fined up to $500,000 for defying emergency orders. Vancouver, businesses can be fined $50,000, individuals $1,000. $1,000 seems to be the going rate in Alberta, PEI, and Montreal. Now, these are provincial fines. It's worth noting that as of yesterday, as we talked about, the federal government has decided to invoke the Quarantine Act, which means there will be further measures that can be applied if people coming back from another country do not quarantine themselves for 14 days. And Trudeau acknowledged this morning that the penalty for breaking that is a fine that could range to tens of thousands of dollars or even jail time. So now there is a federal penalty that isn't incorporated in these lists, which are more for the provincial regulations.
Well, that's very interesting, because I understand that prison populations are the most sort of at risk, or one of the most at risk. So the idea of sending someone to prison because they have coronavirus and they didn't self-quarantine, I mean, probably they'd go to a hospital first and get cured. But I can't really imagine the government mass enforcing this, and it's still not clear to me what it would mean to not self isolate. I mean, are you allowed to go for a walk? Are you allowed to go to the grocery store? I know there's a park across the street from my house, and a City of Toronto official was there first thing this morning with tape, and he wrapped it all up and basically just cordoned it off so that no kids can go on the swing. Heaven forbid a little kid goes on a swing and gets too close to another little kid. It really at this point seems that we're overreacting because we didn't react enough, weeks and months ago. But that's my personal opinion. So there was also an order out of British Columbia that I saw. BC orders hotel operators to provide accommodation services for purposes of self-isolation, supporting essential workers, or other purposes identified for the province. Do we know anything more about that order, Andrew?
Yeah, so basically provinces under their emergency powers and the federal government as well can effectively abscond with property if they need it for dealing with the emergency. So this happened in New York City, by the way, where the Four Seasons in Manhattan was converted to by the government to an accommodation facility for anyone who's working in healthcare. So, doctors, nurses, other frontline care workers that the government designates, and the hotel has to put them up. Now, I don't know what the compensation structure is, if anything, if the government's paying or if it's just seizing it. As far as British Columbia is concerned, I don't know if you get to choose the hotel, if it's like the Fairmont waterfront or just like the Howard Johnson down by the lake. But we do know that the BC government is basically using that emergency power to say, look, your hotel belongs to us now. And it shows that they're trying to import a lot of healthcare workers from different parts. And we know that healthcare workers are actually exempt from the quarantine when you enter Canada. So if you're a nurse coming back from the United States, and we talked about this a bit yesterday, you don't need to quarantine for 14 days because the expectation is that they can put you to work right away. But the other part of this is that the federal government under this Quarantine Act can also use the same power to turn properties into quarantine centers. So the federal government could take a hotel near the border and say, we're housing people that we don't think are going to go home, or that may not have a home to go to, and we're going to put them in this quarantine facility. So they are stepping this up a fair bit now.
Wow, yeah. It really is starting to feel more and more like a war effort. I know Premier Doug Ford referred to this as sort of like a wartime effort. I know U.S. President Donald Trump said that he's now a wartime president. So that it really is starting to feel that way. Andrew, okay, we're going to end the show today on two positive notes. We usually end the show on one positive note, but we have two good news stories today. So the first one is out of Ontario. Bars are reopening again, or something like that. Andrew, why don't you handle this story?
They're not reopening in the sense that you can't just decide to go clubbing now if that's your jam. But effective immediately, licensed restaurants and bars in Ontario can sell alcohol takeout or delivery between the hours of 9 a.m. and 11 p.m. So restaurants and bars have been shut down in Ontario with the exception of takeout and delivery. Now you can order a glass of wine or maybe a big pink margarita type thing, or a Bellini, or whatever your beverage of choice is with your order. And this is actually great because now dinner is served in Ontario. You can get your cocktails as well. So this is one of these things that I hope lives past the pandemic. One of these things that, the alcohol rules across Canada are far too restrictive. I'm not even a huge drinker, but I think if this keeps on the books after the coronavirus crisis is behind us, it'll be a very good thing for free markets.
Well, absolutely. And I just will say, one of the things that I do remember from the 2008 financial recession is that, markets tanked. It was really, really bad. But everyone was sort of commiserating at their local pub and local bars. And I know that the sort of, the amount of profits that those companies were receiving was kind of through the roof. So even in that really drastic financial recession, bars and restaurants were doing really strong. That was part of the reason it helped bridge that initial gap in the economy. So part of the reason that things have been so dire here in both Canada and the U.S. is because people can't even go have a pint at their local pub.
Yeah, you have nowhere to commiserate. That's how bad things are, because what you're commiserating about is the lack of being able to go out and commiserate. It's very meta.
Very meta, very meta. Well, that is good news. And then we have another good news story that's coming straight from us here at True North. So I'm actually really excited and proud of this initiative. Here at True North, our team has has put together a coronavirus assistance map. So you can go onto our website and you can see all of the local sort of charities, food banks, Meals on Wheels, shelters. We did as much research as we can, and we put it all together in a map. So we are really encouraging members of True North Nation and people tuning in right now, anyone who might have the means to help out your fellow Canadian in their time of need. I know that a lot of people are out of work, a lot of people are struggling financially, so I'm not talking to you, but if you are someone who hasn't been adversely affected so far by the economic turmoil that's come as a result of coronavirus, and you have some means, you haven't been going out to your local pub, you haven't been going out to restaurants, and you have a bit of money left over, consider donating to a local food bank, a shelter, one of the organizations. I mean, this list is by no means extensive. We've probably missed many, and if you know of any good charity out there that's doing work to help folks in need of the coronavirus, please let us know. We'll add to it. It's sort of a work in progress, but we're really excited. We're calling on everyone in True North Nation who has the means to just open up your wallet. It's a time like this that you really need to rely on the community, on individual goodwill of civil society to just be there for one another. Some of the services include grocery deliveries, which is really vital for people who are in the more vulnerable population that are self-isolating. A lot of people are scared to leave their house and they need groceries. They don't have them in the house. So some of these services are just doing really good work. And because of the crisis, they're all short on supplies. They don't have enough volunteers. They don't have enough cash. So again, go check that out. It's on our website, tnc.news. And if you are able, please consider making a donation to one of your local groups, or if you can, go out and volunteer personally. I think that, if you're healthy and you're not someone who's recently returned to Canada, maybe you can go out and deliver groceries or do something like that. So please help out if you can. So Andrew, thanks so much for joining me on the update, and we will be back again on Friday.